Hi guys, welcome back to my channel. My name is Ziad, Crohn's disease patient, NHS worker and educator, here bringing you IBD facts and taboo breaking chats. Don't forget to like, comment, share and subscribe on my channel. So let's get started. Hello and welcome to this lesson on nutritional therapy for IBD. Now, the type of nutritional therapy that will be used will be dependent on a series of different factors, but there are three types of nutritional therapy that can be used to help those with IBD. First one is oral nutritional supplements. So these are sterile liquids, semi-solids or powders which provide the macro and micronutrients that can be used in combination with food to support nutrition in those who are unable to meet their nutritional needs by food alone. Then we have exclusive enteral nutrition, and these are specialized liquid feeds that can be administered through feeding tubes in those who have a functioning digestive system but are unable to take oral nutrition supplements orally or who are unable to consume enough energy through nutrients alone. And then we have parenteral nutrition. This is the intravenous delivery of specialized feed through a cannula directly into the bloodstream. So with oral nutrition supplements, they are generally the first step in providing nutritional support to those who need it, as they can provide more than 500 calories per day, but needs to be regulated in those using it as a form of supplementation without waiving the need for normal food intake. Cases can arise where ONS is not sufficient to nutritionally support the individual, which is when enteral nutrition is considered as a form of supportive therapy. With exclusive enterial nutrition, it can be done either orally or using a feeding tube, which is inserted through the nose, which empties into the stomach or small intestine. These tubes allow the exclusive enterial nutrition to be administered without the need for people to take them orally in cases where swallowing is compromised or difficult. Now, these specially formulated drinks consist of either polymeric, elemental, or semi-elemental drinks, all of which contain differing amounts of nutrients depending on what the person is malnourished in. Exclusive enteral nutrition is well established as a first-line therapy for children and teenagers with Crohn's disease. This is because it avoids using corticosteroids, which have side effects that can delay their growth. Enteral nutrition is used mainly for Crohn's disease because inflammation from the disease can affect the small intestine, which is where the body absorbs all of the essential nutrients from the food we eat. And exclusive enteral nutrition is designed to be exclusively used as a substitute to solid foods for between 6 to 8 weeks, giving the bowel a rest from physically breaking down food. With parenteral nutrition, it is the delivery of electrolytes, macronutrients, and micronutrients through intravenous methods, bypassing the normal process of how food is absorbed from the gut and ensuring they go directly into the bloodstream. Parenteral nutrition is not recommended in those with ulcerative colitis unless intestinal failure has occurred. So let's move on and look at the different type of micronutrient supplementations that are available for IBD. So one of the main nutrient deficiencies is iron. So iron deficiency anemia is common in those with Crohn's disease and ulcerative colitis. Those with Crohn's disease can become deficient in iron by the inflammation of the intestine, impairing its ability to absorb iron, and either through the loss of appetite causing not enough iron being obtained from the diet, as well as blood loss leading to low levels of iron in the body. In ulcerative colitis, iron deficiency can still occur due to the bleeding caused of the colon. So iron supplementation can either be given orally through tablets, which include using ferrous sulfate, which is usually the first choice for iron supplementation in those that can tolerate oral supplementation. However, it can cause side effects such as constipation, abdominal pain, and changing the color of the stool to black. In those who are unable to tolerate ferrous sulfate tablets, an alternative medication called ferric maltol is used. In severe cases of anemia, intravenous iron infusions would be considered, which is the infusion of iron delivered over the course of 30 minutes through a vein in the arm while you are in hospital. Vitamin B12 deficiency can occur as well. Now, in those with Crohn's disease who have inflammation in the terminal ileum or have had a large portion of their ileum removed, are at an increased risk of vitamin B12 deficiency. This is because vitamin B12 is absorbed in the ileum of the small intestine, and having it removed or partially removed reduces the available area to absorb vitamin B12. In cases of vitamin B12 deficiency, or severe cases, vitamin B12 injections can be considered to address this issue.
Folic acid supplements may also be needed in those with IBD. Now, folic acid is also known as folate or vitamin B9 and works together with vitamin B12 in the formation of new red blood cells. It's also an important vitamin during pregnancy as it can reduce the risk of neural tube defects and folate deficiency anemia occurring. The metabolism of folate is closely linked with vitamin B12 and B6, and a deficiency in all of those can cause something called megaloblastic anemia. Now, there are several ways folate deficiency can occur in IBD, either due to poor nutrition, malabsorption, inflammation, and medications such as methotrexate causing the deficiency. Vitamin D deficiency can also occur in IBD. Now, vitamin D is important because it contributes to the absorption of calcium and phosphate needed for healthy bones and teeth, and has a role in the normal function of the brain, the nervous system, cellular growth, and the regulation of the immune system. Deficiency in vitamin D can cause the poor calcification of bones, and in children with vitamin D deficiency can cause something known as rickets, and in adults it can cause something known as osteomalacia. Inflammation of the intestines can reduce the amount of vitamin D absorbed through the diet, as well as steroidal treatments impacting on vitamin D levels. In adults and children with active Crohn's disease and ulcerative colitis receiving steroidal treatment, it is recommended that serum calcium and vitamin D levels should be monitored, and supplementation provided to avoid low bone mineral density, osteopenia, and osteoporosis. And lastly, calcium supplements may be needed. Now, calcium is an essential mineral as it contributes to normal functioning of our vascular, nervous, and skeletal systems, as well as contributes to building strong bones and teeth while helping our blood to clot normally after an injury. A deficiency in calcium can lead to low bone density, osteoporosis, rickets, and osteomalacia. So to summarize, we've looked at the different types of nutritional therapies such as exclusive enteral nutrition and parenteral nutrition. And we've seen how those different types of nutrition are used to support those with IBD, as well as the different types of supplementations for nutritional deficiencies.